everyone, and welcome to Instagram Live with Intimate Rose. I'm Dr. Amanda Olson, and today I am joined again by the always marvelous Andrea Martin. She's a nurse practitioner, and she specializes in care for patients that are in perimenopause and menopause. Today, our topic is headaches. We're going to be discussing how hormone therapy can affect headaches, why changes in hormones can cause headaches, or when appropriately dosed, take away those headaches that are hormone driven. And if you listen all the way to the end today, we have a special 10% discount code, so you want to stay and watch the whole thing. And I'm very excited because I get to see her live next week at ISHWISH conference, and it will be a fantastic conference in Atlanta. Hi, Andrea.
Hi. How do you do?
What's that?
I said, how do you do?
Hello. Oh, it's been way too long.
I know. I will try not to get the flu again. That was part of our problem.
How dare you?
I'm sorry.
Part of being a person, as I always tell my boys, we get sick sometimes.
Oh. Ew, this was a rough one.
I'm so sorry, but I'm so glad to see you now here live. And at this time next week, we will be together in person in Atlanta at the ISHWISH conference.
Yay. We love ISHWISH.
Yes, we do.
The most funnest conference there is.
Yes, I agree. So today we are talking about headaches, the role of hormone therapy on headaches, both bringing them and taking them away when appropriately managed. And for our listeners, we have a special discount code that we're going to give away at the very end of this talk. It's going to be good from today, which is February 20th, until February 27th. So don't let me log off of here without telling them what the code is.
Never said that. I'll try. All right, so let's jump into it. And I'm going to be a little bit more specific and talk about migraines specifically. So migraines, moving this over, are headaches, terrible headaches that happen unilaterally. So one side of your head only. Lots of pulsating. The symptoms can be like moderate to severe. It's not just like a little headache. It's a whole thing. They can last all the way up to 72 hours. A lot of times people will have like nausea, vomiting, sensitivity to light, to sound. You know, they can't necessarily exercise. And we see them a lot more in women than men. So one other thing to note about migraines is there's also something called migraine with aura. And an aura is basically some type of little signal you get that's like, hey, migraine's coming your way soon. So one of those scariest signals is that can happen to people is they can actually just lose their vision, which is a very scary thing. Maybe seeing like zigzag lines, even getting like numbness and tingling, which is all this is important because when you have migraine with aura, you're at like a higher risk of stroke. So migraines also go into a little category. So I'm going to kind of focus mostly on hormonal migraines. But there are migraines that have nothing to do with hormones. Like a lot of people know their triggers are like alcohol or no sleep or stress, that type of thing. So these specific type of migraines we're talking about are very much influenced by hormones. So they usually start at puberty and then they get better in pregnancy, terrible in perimenopause, and then they typically get better in menopause. And that's just because hormone levels have such a big influence on this, especially estrogen. So a lot of times women will endorse having like either the week before their period or the week of their period, like terrible migraines. It happens every month. So we know when it's on that cyclic pattern that it's probably a menstrual migraine. And it's happening because estrogen levels are taking a big dip. Some women end up having their first migraine ever in perimenopause. And that's because at that time, your hormone levels are totally erratic, all over the place, up and down. And that's like really irritating to your brain. Your brain does not like that. So what do we do about this? How can we treat this? Actually, one of the more helpful options, especially if it's someone that is still cycling, is contraceptive pills. So what the pill does is keep your, hormones from like bloop, 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 and just kind of keep it at a steady state. So avoiding those big changes can really help with those migraines, especially if you skip the placebo week. So just keep taking it. You don't need that like fake period. It's a withdrawal bleed and you're just going to get a migraine there. So you just keep taking it steady. One kind of, I guess, spot of controversy is patients with migraines with aura for their whole lives have been told, you can't take any type of pill with estrogen in it, contraceptive pill. That's still the official guidelines. However, there may be some practitioners you can have a conversation with because a lot of the data we got about oral contraceptive pills and migraine with aura, they said, it's dangerous because that can cause a stroke. But this data we have is like over 50 years old, and it was much, much higher dose of estrogen. Another point to make is that the less migraines that you have, prevent them, you're at, a decreased risk of stroke. So in certain patients who don't have other stroke risk factors, if they do have migraine with aura, you might find somebody that's comfortable providing an oral contraceptive pill. So then those who don't want to be on birth control, there's hormone therapy. Specifically what we would do, so if somebody had migraine with aura, I probably wouldn't give them a pill. I would give dermal option, which is, a little bit safer, a little bit less risk of blood clot. So like patches that you put on once or twice a week have the most steady state of hormones, so that can be really good. Some people like to do it throughout the whole month. Some people at first just start doing it like that week before their period, week of their period. There's a lot of options there. And hormone therapy doesn't stop ovulation if you're still ovulating, but it just kind of adds in a little bit of estrogen so that those lows aren't so low. It kind of buffers it out a little bit. So I think a lot of times people in general think like, migraine plus hormones equals bad, but that's really the conversation. It's funny because estrogen and the changes in estrogen can certainly contribute to those headaches, but they can also like help prevent them and treat them. So it's not if you have migraines, you can't take hormone therapy or it's going to make things worse. It actually might make it better. And then after menopause, when everything's just way quieted down for most people, they don't have to worry about that anymore. It's a good time. Headaches anyway. And other things.
Thank you so much for clarifying all of that. Do you ever see new onset of migraines or headaches, really significant headaches when patients start hormone therapy newly?
I have not as much as I tend to see it take away their headaches, but yes, that can happen to people where they start their estrogen and they're like, oh, I got a splitting headache. So a lot of times we'll just like lower the dose down and take it a little bit slower, and that tends to take care of it. There are the rare people that just like, nope, this does not work for me. There's always somebody that has some kind of incompatibility that of course works in most other people, but yes, we do see that.
Absolutely. That's wonderful. Thank you so much for outlining that. Does anyone that's joined us have any questions?
I know. I feel for people with migraines, especially the menstrual ones. It's once a month, like clockwork. You can expect it, and you lose days at work. You can't take care of your kids. You can't do anything. And to have something so regularly just kind of rock your life is not acceptable.
No, but like you said, manageable with the right levels of hormone therapy, whether with the oral contraceptive or other means around that perimenopause and menopause place. Wonderful. I don't think we have any questions. Is there anything else that you would like people to know about hormone relationship to headaches?
I think the only other thing I would say is if somebody does go the route of using like an oral contraceptive pill, there's different types of pills. So there's like monophasic and triphasic. At some point, somebody thought like maybe we should make pill packs where like there's slightly different levels of hormones in each week because it'll be maybe mimic a natural cycle more, which it doesn't really, but whatever, good thought. if you have migraines, you don't want to go with a triphasic because again, our goal is we're not looking for variability. And if you've got, 1 week here, 1 week there, you can kind of defeat the whole purpose of trying to use a pill to stop your headaches.
That's really good information to have. So patients should advocate for themselves with that information and be sure to speak up about other symptoms. And that's why we take such a thorough history about all the little things that don't necessarily pertain to gynecological health. We want to know about all the parts of your health.
Yes, and sometimes you might need to work in tandem. Like some people will have a neurologist and they'll have their OBGYN, and sometimes you might have to be like, I need you guys to talk to each other, or like, hey, neurologist, this seems cyclic, how do you feel about me trying this? And they might be like, yeah, I totally agree with you. I'm not comfortable doing that, so then you bring in your, women's health, whoever practitioner that can then prescribe the birth control or the hormone therapy. I think some neurologists are comfortable with birth control pills, but I personally haven't seen any that are like, sure, I'll prescribe your therapy. I don't blame them. They got a lot of other stuff to do. So
Absolutely. They tend to sequester themselves. That's right. This is my zone.
and as we know, of your body can influence here, but everybody likes to stay in their own little location. I would
Exactly.
the pelvis and the pelvic floor too. People are like, I treat from here to here. I treat from here down, and everyone's like, I don't want to do the pelvis. Or it's connected to everything, but we'll just ignore it.
That's exactly right. And we'll just look at the whole person as a whole.
Exactly.
Wonderful. Well, thank you so much, Andrea. Our code for this week to give our wonderful communities 10% off is, of course, headache. So that code is good from today until February 27th. And they can use that to buy any of our tools, lubricants, and balms. It's just not applicable to our current telehealth programming. So they can use it to buy whatever else they want. So stock up on your supplements, your tools, and your lubricants. And we will be going again in 2 weeks. We will then be discussing endometriosis and hormone therapy and how endometriosis can change and present itself in the perimenopause and menopause phase of life. And probably we're going to have all sorts of great conversations next week that we'll be able to come back and share with people as well.
Absolutely. I'm looking forward to 2 weeks because you're going to kick my butt. You're like the endometriosis queen. So I'm like, teach me. If I say something stupid, let me know. Because poor people with endometriosis just hear a lot of stupid stuff over and over.
They do, but the thing about you is that you research things so well that I don't see you ever saying something stupid. So don't you worry.
Trust me. Trust me. Something will come out and has come out that I'm sure is completely inaccurate. That I'm like, yeah, I think that's true.
We'll have our fact checkers fact check it. Wonderful. And it'll be perfect timing because March is Endometriosis Awareness Month. So we'll be kicking off the month. Right. So our little delay in programming will have been for a good reason. But I'm so glad to have you back and so glad you're feeling better. And I cannot wait to give you a hug and see you live next week.
Yay, me too. Looking forward to it.
All right. I'll see you in Atlanta.
Bye.
Bye.